Hi everyone, this is Nkechi Glory. I'm a medical practitioner, a nurse by profession. So I'm going to discuss a topic today which is prostrate. I'm going to take it gradually so that everyone will understand it, we know it. I'm not going to rush. So what do we now understand by this prostrate? Because some people in their mind, they feel prostrate is a disease. Prostrate is not good in men, but it is not like that. Prostrate is a normal reproductive organ in men. It has a very important function. It is the prostate that secretes prostate fluid, which is the important component of the semen in men. So do you see the importance of it? It is located at the neck of the bladder. It is in front of the rectum and it has a walnut shape. That means it is very small. As time goes on in man's life, or as man grows older, the prostate can enlarge in size. Now, from 40 years of age, that is when we start to battle the problem that comes out from the prostate. It may now lead to prostatitis, prostate enlargement, or prostate cancer from 40 years of age. Now, I want to tell you the things that you will see, you feel. That means the signs and symptoms that you will feel. Whenever you feel it, you will run to your doctor to complain. What are these signs and symptoms? Normally a man don't supposed to feel pain when you are urinating. But in this case, if you are feeling pain when urinating, you know that the problem is setting in. You feel pain during ejaculation, which you don't supposed to feel pain during ejaculation. You know that problem is setting in too. You are having frequency of urination at night instead of you to sleep, maybe, or instead of you to have 2 times urination, you now have it up to 5 times at night, going up and down to urinate. That is the frequency of urination. It is not normal that way. You feel when you are urinating, the urine is dribbling. It is not normal that way. You see blood in your urine, you see blood in your semen. It is not normal that way. When you see all this, when you notice it, you run to your doctor and complain so that they'll start early to sort the problem that is uploading. Now, what are the causes? The causes we say is idiopathic, which means it's unknown. But there are so many factors that can link to this. What are these factors? Aging. Earlier on I told you from 40 years of age, a man can develop this, may develop this, because it is not every man that may develop it. So from 40 years of age, that is why we are now mentioning that aging can lead to this. When you are aging, you may develop it. If you are such that take much red meat, it leads to this. Too much alcohol or alcohol, let's say alcohol, either much or small, it can lead to this. Caffeine can lead to this. Saturated food, dairy food, processed food, they can lead to this. So what can we do? There are so many things that we can do to prevent it from occurring, to stop it, or to reduce it. So what are those things? You manage your stress. There are so many stress out there, but you have to manage it. Let you try to manage the stress that comes your way so that you will not develop this. You now practice a safe sex. What did I say? You practice a safe sex. You reduce your alcohol intake or you stop your alcohol intake. Reduce the intake of red meat or you stop it. From 40 years of age, both man and woman, you don't supposed to be taking red meat. You can take your chicken, you can take other meat, but anything red meat, you stop it or you curtail the intake of it. So if you are practicing all this that I mentioned now, you make a change in your lifestyle, you manage your stress, you live, a life that will not lead you to this, take much fluid, you'll be better and you may not develop it. So try as much as possible to live a life that will not lead you to this. We love you. You are wonderful men. You are lovely men. We want you to have a wonderful life. We want you to live a better life. See you another day, and we are going to discuss other important topics. Thank you, and God bless you.